We're now going to spend some time discussing infectious diseases. Don't be alarmed if some of the infectious diseases are not in this particular chapter, because many of the topics are discussed in other chapters, in the appropriate chapters for those organ systems. We're going to start out with something that's somewhat unique to children. That's fever without a focus. Once again, remember the age of the child. First of all, the definition of fever is a temperature greater than 100.4 Fahrenheit rectally. That is the actual definition of fever. In pediatrics, we always think of a fever, the cause of a fever being infectious first, and certainly other things can cause fevers too, such as certain chronic diseases, malignancies in particular, but we always think of infections first. You need to know for the exam the organisms by the age of the patient. Certain age ranges are predisposed to certain organisms. We'll discuss them and mention them as we go along. In younger children, there's a high risk of occult bacteremia. When we live with germs all around us and in our bodies. When we brush our teeth, for example, we can actually release some of the germs in our mouth, the oropharyngeal flora. They can get into the bloodstream, and typically they're cleared very easily. Children don't clear as easily when they're younger because they're immuno-naive. They're not immune suppressed, but they are immuno-naive and they have different immune responses, and so sometimes the younger children don't clear organisms as well, and they can have what's known as occult bacteremia. Below you have a table that shows what risk factors put you at certain risk for occult bacteremia. Certainly, we're going to see occult bacteremia more commonly under 24 months of age, typically about 3 months to 24 months of age. The higher the fever, the greater the odds of having a positive blood culture. So a temperature greater than 102 and definitely greater than 104 puts you at much higher risk of having a positive blood culture. By occult bacteremia, what we're saying is that this child has fever and bacteria in the bloodstream, but no identifiable source on exam. Patients with chronic disease are at higher risk for occult bacteremias. Patients that are immune deficient or patients with sickle cell will be at higher risk. You have to look for a past history of contacts. Patients that go to daycare are around other children that cough and sneeze, and that puts you at higher risk for catching something. Signs and symptoms. The child that has a higher risk for occult bacteremia usually has more signs and symptoms, such as ill appearance. They sometimes can be toxic. They can be irritable and lethargic. The white blood cell count greater than 15,000 indicates a higher risk for that child having an occult bacteremia. We're going to break it down into more groups. We've already discussed the neonate and the common organisms that can cause problems in the neonate. We mentioned Group B strep, E. coli, Listeria. Don't forget herpes simplex. We mentioned in the neonate predispositions such as prematurity, mom with a urinary tract infection or chorioamnionitis. All these things predispose the neonate to infections. Now we're going to discuss a slightly older child between 28 days and 3 months. If these patients look sick, they need to be admitted. They do not contain infections well and are higher risk to have more serious infection. If they have documented fever in this age group, it's very important to do a thorough exam looking for a source of infection. A white count greater than 15,000, an absolute neutrophil count of greater than 1,500 bands puts you at high risk. These patients, you need to obtain cultures. Typically, we'll do blood cultures and urine cultures. They may require spinal tap, and antibiotics are started empirically, again, knowing which are the common organisms. Ceftriaxone is a good first choice. If the patient is greater than 3 months of age, at any time that they're toxic appearing, they need to be admitted. And you proceed with the same workup as far as getting cultures and starting empiric antibiotics.